you so much for being here today, and welcome to PMC. My name is Tiziana Rivera. I'm the Executive Vice President for Quality Research and Chief Nursing Executive here at Osler, and I'll do a little self-plug. Today is my 6-year work anniversary. Yay! I can't believe it's been 6 years. So yeah, it's definitely a celebration. And really appreciate those who have come out in person and online who are joining us really to celebrate a momentous time in our history at Osler and for our community. Before I begin, I do want to extend my sincere gratitude to Patty Rempel, who is our Director for Research, and for Sophia Ramirez, who is our Communication Specialist for Research, who have been orchestrating all of these phenomenal events over the week and all of the online activities. So I couldn't have done it without you. So thank you. So now I would like to welcome our President and CEO, Dr. Frank Martino, to make opening remarks.
It's been 6 years. Oh, goodness. Seems like yesterday. No, I am kidding. You have this on your seats, and I encourage you to go through it. It talks about the Osler Research Institute strategic plan, but what is so fitting is the front cover has a light bulb on it. And often what research does, it sheds light on what we don't know and what we should know, and brings discovery to bear. And I think it's a wonderful pictorial that will speak to what we're going to try to do today and what we're going to try to do all week and for years to come. So this morning, I'm extremely excited and I'm so pleased that you're all here today to join us for the official launch of the Osler Research Institute for Health Innovation. As Tiziana said, today is a pivotal moment for the Research Institute and for all of us here at Osler and for our community. And as President CEO, I can't be prouder of what we've achieved and what this will mean for our organization. We have a new strategic plan, the 2024-29 strategic plan, going beyond for our people and communities. And it really charts an ambitious course for what I believe will be the most historic chapter for our hospital and for healthcare here at Osler and across the regions that we serve. Research and academics is really a key pillar of that new strategic plan. And this includes a commitment to new research that translates into innovation and innovative approaches to provide care for this vibrant, diverse community that we serve. Today's launch of the Research Institute for Health Innovation, and I was corrected the other day, it's ORIHI, not ORI. It's ORIHI, is an important step forward for achieving our vision of world-class healthcare inspired by our people and our communities. As a physician, I've had the benefit and I've been fortunate to be involved in many research projects over the years, and I'm excited by the promise of elevating research and discovery, learning and innovation through a research institute. I began my career as a research student, a summer research student at the Hospital for Sick Children, and I was really impacted by a young man at our launch on Monday who said, you know, Dr. Martino, I no longer have to go to University Avenue. Right? We have it right here in our backyard. Nothing excites clinicians more than the excitement of new discovery. As one of Canada's largest hospitals, we have an incredible foundation of expertise led by a stellar group of researchers who will be committed and continue to push the boundaries of science and innovation and the impact that will have on healthcare for this generation and many generations to come. So this is day 3 of Celebrate Research Week 2024. It's a remarkable and diverse roster of activities. You'll see some of them here today. Some are at our other 2 sites, other 2 major sites. There'll be thought-provoking panels, art installations. I encourage you to go to BCH. There are some really innovative connections between art and research that I hope you'll have an opportunity to experience. And we'll have a number of keynote speakers, including this afternoon. So this week is not only a showcase for research excellence by Osler and our incredible partners, it also represents a catalyst for new opportunities, partnerships, and knowledge generation. So congratulations to Tiziana Rivera, Patty Rempel, their entire team for curating this incredible week for all of us. And I thank you all for participating. And so now I have the opportunity to welcome one of our board members, our vice chair of the board, Elsa Cabral, who also all of us have experienced as a very capable committee member. She used to chair the Committee on Health Services and Quality of the board for Osler, and now she's our new chair of governance and HR. And we were just on a meeting this morning at 7:30, so you know that Elsa's been up early, just as many of us have. So welcome, Elsa, please come to the podium.
Good morning, everyone, and thank you, Tiziana, and thank you, Dr. Martino, for the wonderful introductions. I'm very happy to welcome you all here today. It's a celebratory week, and definitely looking at the incredible work that has and is happening within the research community at Osler. It's an honor to be here with dedicated individuals who work tirelessly to improve the health and well-being of our community. And this is with research and innovation, because this is how we make an impact and make a difference in our health system. And that will be what we're going to hear more about today. As the vice chair of Osler's board of directors, I'm very proud to not only see this launch, but also the continued growth. It's been a few years. I've had the privilege of listening to and hearing from Patty and Tiziana and other members of Osler talk about this 10-year journey of the Research Institute, and to have it come to life is quite exciting. It is a testament to the strength, the collective strength of Osler, of its community partners, and of Osler's researchers. So really thrilled to be here. I am excited about today. I'm excited to hear from our panelists. I'm excited to learn more about how research and innovation is going to continue to make an impact on our health system. We need this more than ever. And it's so nice to see this community on the map. A lot of exciting opportunities coming forward. The strategic plan just gives me goosebumps. I hope you are all excited for today's panelists, and thank you again for joining us. I look forward to the conversation ahead.
Thank you, Elsa, for your remarks, and really want to appreciate other board members who are here today. The commitment from our board has been incredible, that has made this journey truly one that has been pushing us, advancing us to think differently, creatively, really in an integrated way that's focused on community. And that insight from our board members has been totally invaluable to us as we have done our path forward. So Frank was talking about the Osler strategic plan, and by design, we have incorporated and developed our own research strategic plan. And it marks really a very bold vision for Osler. And it's a new chapter for research within our organization. So over the past year, we have engaged over 3,700 staff, physicians, volunteers, community, academia, industry partners, really in terms of getting their insights, in terms of what would it mean to have an institute here at Osler, and what would it focus on? And we really captured those thoughts and reflections so that we would then be able to integrate them and have it reflected back to the community in a really engaged way. We also engaged our community-based research advisory committee, and some of our members are here today. And what I just want to do very briefly is give you a very high level of what our research institute is aiming to achieve and our vision for the future. So at the heart of everything we do is our purpose, and that's transforming discoveries into practice for better health. So it continues to be the driving force for us in our work, and we're really wanting to close the gap between research and practice. We know that it sometimes takes decades to implement new innovations and research findings into practice. And we know that if we take questions that are meaningful to our community and we integrate them into practice, it will have a positive impact. Our strategic pillars are built around three main areas, and that is personalized health, population health, and health systems. And we'll continue to work on these three pillars over the next 5 years as we continue to grow. And so the first one really is around leadership, people, and culture. And we know that at Osler that diverse ideas, collaboration, and continuous learning are essential for impactful research. And we know that our people are our strength. The second strategic priority is around collaborations and community. Our research must reflect the priorities of our communities. And in my conversation earlier this week, I was speaking with a community member, and they were really excited and proud that in our community, we have a research institute that is going to be examining questions and problems and researching issues that are important to this unique community. And that was something really powerful. I'm holding on to that because that's really, that impacted me. I keep reflecting on that statement and what it can mean to our community. Sustainable funding is one of our strategic priorities, and that is around ensuring that we get a diverse funding source. We have to raise our funds, and we have to partner with others to be able to conduct our research. And knowledge sharing and translation. And today and all this week, we've really been engaging in that activity around knowledge sharing. We have to disseminate our findings. We have to ensure that we get the findings and really apply them into practice. And the fifth one is really around research services and infrastructure. So you know that today we had this platform, we can get on, we can sit, and we can utilize it. From a research perspective, we have to do the same thing. We have to build the infrastructure so that our researchers, our scientists, can actually just step on and start doing their work and start contributing from a scientific perspective. So we're building this together to ensure that researchers and patients in our community who want to be engaged in this work have the opportunity to do that. And so over the past decade, we've contributed to scientific community in remarkable ways. And today we're really excited to share what the new path will bring. And now I'd like to invite our two CBRAC members, Community-Based Research Advisory Council members, Mark Mohan and Isha Dillon. Thank you very much. To reveal the new banner for Osler Research Institute for Health Innovation. It stands here at PMC as a symbol of our commitment to pushing the boundaries of research and innovation. We have had the opportunity to unveil a banner in each of our sites. And when we were at another site, one of the physicians said, "I've been engaged in research for such a long time," and that was really emotional. So it's great. We're generating that kind of excitement. So it's with gratitude that we have this here, and it marks our beginning to the next journey. So what I'd like to do now is invite Rishika Thakur Malhi to the stage. Rishika is the executive lead of the Central West Ontario Health Team and Director of Integrated Health Systems at Osler. Over to you.
Good morning, and thank you for joining us for this exciting panel. My name is Rishika Thakur Malhi. I'm the executive lead for the Central West OHT, and I am honored and privileged to be your moderator today. This session will delve into health system transformation and the role that research, innovation, and collaboration play in driving local change. As we know, the healthcare landscape is rapidly evolving. New information, technologies, treatments, and an increasing emphasis on integrated care are not only reshaping the way we deliver care, but also the health system foundation itself. I'm personally interested in this discussion because of the OHT. And for those who are not aware, Ontario health teams are transforming community care by driving integration forward. OHTs bring together providers from across the continuum of care to deliver integrated care that is accessible, equitable, and made for our local communities. OHTs make data-driven decisions about population health to bridge gaps for our most vulnerable and at-risk patients. And we're implementing new models on the ground, making improvements and evolving in real time, and in that way serve as incubators for health system transformation. So before we dive into our transformation discussion, I'd like to introduce our distinguished panelists. Dr. Martin Chasen is the Medical Director of Palliative Care at Osler. Dr. Chasen's leadership is transforming our approach to end-of-life care. With extensive experience and a commitment to patient care and research, he enhances the quality of life for those with life-limiting illnesses. His contributions to the field have earned him numerous awards. Dr. Marco Iafolla is a medical oncologist at Osler and specializes in cutaneous, head and neck, and genitourinary cancers. He leads pioneering research in immuno-oncology biomarkers to enhance patient treatment strategies and has been recognized with prestigious awards in oncology research. His work stands at the forefront of improving patient outcomes and advancing cancer care in Ontario. And Tiziana Rivera is our Executive Vice President of Quality Research and our Chief Nursing Executive here at Osler. She's a distinguished nursing leader with over 30 years of experience. She champions nursing excellence, transformative healthcare, and quality improvement initiatives. We're very fortunate to have such an accomplished group of experts with us today. So as we move forward today, we'll be exploring several key topics, including what health system transformation means locally and how data and research continue to make this transformation a reality. How ongoing innovation in fields like oncology, palliative, and quality in practice are shaping better outcomes for our patients, and how collaboration across specialties, sectors, between researchers, clinicians, and administrators is essential to creating a truly integrated and effective healthcare system. So we're looking forward to hearing our panelists' perspective on these topics. I encourage everyone in the room to think about how you can contribute to this ongoing transformation in your work and for our communities. So with that, let's get into our discussion.
Good morning to all of you. As we're getting on to our topics over here, what is health systems transformation? Okay, next slide, please. Other way, back. So I thought of starting off with the POET project, which has been developed by Paula and others here at Osler, and it's really looking at the long-term care homes and their obligation to meet the consent, the capacity, and substitute decision-making for residents and their families when they enter the home. And these people work with each individual home and they work individually and learning who works there and who is currently doing the work and what are they doing and how can we help them to design and test the changes related to consent, capacity, and substitute decision-making or decision-making. Next slide, please. And I thought of differentiating and understanding what this palliative care continuum is. What is actual palliative care, and what is the palliative care continuum? And you can have a look at on the extreme right, we talk about end of life care, and that's active symptom management, whether it be physical, psychosocial, emotional, but it's caring for the person as a human being, knowing that, of course, human beings aren't just a body, but there's a soul and there's an internal rhythm within that patient or that person. It's looking at grief and bereavement support, and this is where end-of-life care is important. It's not just the end of life, but it's the shortness of life afterwards for families and friends that are left behind. And look at the palliative care approach is on a broader perspective. So it's taking people that have got a life-limiting illness that are probably only expected to live another year and optimize that quality of life. If they have pain, nausea, vomiting, anxiety, depression, etc. And it's to assess them early and to provide early, regular symptom assessment and management. This is vital for the person's well-being as they move through the journey. And adopting and changing and embedding a palliative approach to all life-limiting illnesses, not just cancer, but end-stage cardiac failure, end-stage renal failure, end-stage respiratory failure. So it's across the spectrum of diseases that people and their families engage in. And it's also to engage with, that we said, the whole community support, the family support, and to engage in advanced care planning so that it doesn't just come as a big shock that suddenly the family know this patient is at the end of life, and then what can we do, what can be done, and why did nobody tell me? But rather to prepare the person and the family for what we believe is the future. And fortunately, we now have also very good tools. There's one called the HOMA, hospital mortality rate, which actually more than 95% can accurately predict who is going to live a year and who would not. Taking on all the characteristics when the patient is admitted to hospital, how did that patient get to hospital? What, who do they live with? How many times have they been in hospital? So really practical applications to patients and their family recorded in the HOMA. Next slide, please. And so we look at the Health Act and see what is the purpose of this act. And it's to provide rules with respect to consent to treatment that apply consistently in all settings. It's not just this patient coming in and they've got pneumonia and we should give them antibiotics. It's looking at that whole person. Do they have an underlying cancer? Have they lost a lot of weight? What do the family feel? So it's holistic. To enhance the autonomy of persons for whom treatment is proposed, persons for whom admission to a care facility is proposed, and persons are to receive personal assistant services. So it's looking at this person and saying, what do they need? What do their families need? And how can we facilitate and provide that we provide in the correct treatment to the correct patient in the correct place? And then looking at allowing incapable persons to request that a representative of their choice be appointed by the tribunal for the purpose of making decisions on their behalf concerning treatment. This is why it is so important to have goals of care earlier on in the trajectory of the disease, so that when it gets to a time when that person may not be able to make a decision or an educated treatment decision, to know what they wanted when they could make that decision. And it's not saying that the person's going to pass away in the next month or two if they start speaking about goals of care, because we should start speaking about goals of care so that we are actually giving the right treatment to the right patient in the right place at the right time. And it's allowing the patient that autonomy to make that decision. And I think that this is very important idea of palliative care, is to provide the right treatment to the right patient at the right time with the right consent and with the right family. So considering everybody in final decisions of who's going to care for what and when. Thank you very much.
Thank you, Dr. Chasen. So perhaps we'll move on. Dr. Yafola, how do you define health system transformation, and how has research and innovation in cancer care contributed?
Can everyone hear me? Thanks. I don't have a slide deck, so I'll sit for this one then. So first, thank you for the opportunity to be here. It's a really interesting question. Never thought about before until poised to answer this. So to me, a health system transformation really suggests a change in the current model to one of further improvement and efficiency and effectiveness to create a better patient experience. This can involve optimizing many facets in healthcare, from patient-facing staff, such as clerical, nursing, and physicians, to the many people who run the action behind the scenes, from policy and drug funding, research, information technology, and even maintaining the hospital grounds. Naturally, there are many more variables that go into running and transforming a hospital system. All aspects of healthcare have a direct impact on the patient experience. This starts immediately upon entrance into the hospital and ends with, ideally, an improved state of health, or at least a plan to help minimize deterioration. Ultimately, all patients want to have their concerns acknowledged and be instilled with the confidence that their medical team is supplying them with the best possible care. Hence, all aspects of the health system, from the friendly volunteer who meets you at the entrance to timely assessments and smooth processing between departments, creates a positive impact on patient care. Research, in my opinion, can straddle both areas of both patient-facing and behind-the-scenes operations. Here at William Osler, we conduct many clinical trials. These range from working with industry partners to enroll patients on promising new experimental therapeutics, or conducting non-interventional studies to learn more about their illness and why treatments work for some, yet not for others. Behind the scenes, there are laboratory professionals studying patient tissues, or research students reviewing charts and current literature to help expand our knowledge of various illnesses. Hence, there are multiple teams that work in unison to push the field of medicine further to create a cohesive system that offers better care for patients. Within the oncology realm, the results of these efforts have created new ways to diagnose cancer, discover underlying causes of cancer, and develop new personalized treatments unique for the patient coming into clinic. The want to do better for patients identifies the problems and generates questions that ultimately spur the innovation that drives a transformation. Whether it be new ways to learn about patient symptoms, develop new medicines, or find features in the blood of patients to predict response or side effects from treatment, our want to help patients creates the current model of care to constantly undergo transformation.
Thank you, Dr. Yafola. Tiziana, how do you define health system transformation, and how has research and innovation in quality academics and practice contributed?
Hello. Testing. Oh, great. Awesome. So thank you. And thanks for inviting me to the panel. From a health system perspective, I've had a varied career. So I've worked as a nurse practitioner, worked in administration, worked in academia, long-term care, acute care, community. And I've been informed by that work about as a provider. And I've unfortunately had family members who have required healthcare. And I've spoken about this before, where I've had 4 family members who have passed from medical errors. And so that deeply affects how I see health system transformation. So I want to frame my comments in 3 different areas. One around reimagining our healthcare system, one about person-centered care, and one around the embracing of technology to enable clinicians to provide that care. So from a reimagining healthcare system, transformation really is about ensuring that we don't just tweak the system. We have to look at every aspect of it so that we can meet the needs of our patients, providers, and our community. It's not incrementally making changes, although those are important. It's looking at the traditional colonial hierarchical systems that have been established many, many years ago and trying to better understand, we need to deconstruct this. We need to bring it to another level so that we can infuse these values that we talk about. And I'll speak about one of them, and that is around health equity and access. We've all been part of, because you live in Ontario, we all were part of COVID. And you know how it specifically hit Brampton and our catchment area. It was exposed, the inequities, and we are driven here to really better understand how do we build the healthcare system in a way that ensures that we address the disparities in care based on socioeconomic status, race, geography, and other factors, ensuring that equitable access to high-quality care in underserviced populations is vital to reducing our health disparities. When we do that, we lift all of us up from a health transformation perspective. We also need to ground that into person-centered care. And so one of the core elements of system transformation is putting the patient at the center. If we, as clinicians and administrators, we say, but I do that all the time, and we do. And you do it on a one-on-one. But from a system perspective, we have a lot of areas for growth and development. And what it means is about integrating care that is personalized, accessible, coordinated, and across many different settings. Now, if we want to Uber that and make it even more transformative, we have to connect the healthcare system across between patient care, research, and education. And that's what we're doing here at Osler with our TMU affiliation, with our ORIHI, and with our phenomenal services that we have here, creating a feedback loop. So one informs the other. That's system transformation. That's going to hit the mark. And finally, an enabler is the technology. The machine learning, the predictive analytics, the early warning systems. Clinicians come to work wanting to do the best job ever. And when we enable them to do that, by giving them the tools that help them prioritize care issues, that elevates it. When we just have to remove the cognitive burden from cognitive burden from clinicians, that they've got to remember all these things. When we can have enablers in our system, that's system transformation, because we can advance, minimize risk, minimize critical injuries, and provide best health outcomes for our patients and communities.
Thank you, Tiziana. I love the concept of the feedback loop. Okay, Dr. Chasen, how would you define health system transformation, and how has research in palliative been contributing to this shift?
Thank you. Well, health system transformation is having a vision of how a person would like to see the future in the most beautiful, rosy terms, where either people don't get ill, or if they do get ill, how they can best be treated. And there are many steps to getting there. First of all, knowing where you come from is vital. Knowing what is available and what you can do is important. And knowing what has to be done is probably our goal of achieving this. So I think it's a transformation from what has been to what is and what will be.
Great, thank you. So each of you represents a different aspect of healthcare, from oncology and palliative to practice and quality improvement. How do you see collaboration across these disciplines enhancing the overall transformation of the health system? Tiziana, perhaps we can start with you.
Okay, so one of the things that I reflected on was really, this is heavy in the literature. We know that interprofessional collaboration, interprofessional education, and interprofessional practice actually drives high patient satisfaction, positive patient outcomes, and a more efficient and equitable system. And so whatever we do, and I'm thinking about this in my role as an administrator, is really around how do we create the infrastructure for that to happen. And so I'm thinking about how do we create those platforms, and I'm reflecting about what we're doing here at Osler. We recently created a QI Academy. And so that's a platform where we had physicians, staff, and other leaders across the organization, all interprofessional, that came together to look at issues that were pertinent to them that they wanted to positively impact. They came together in a room and they studied and they learned and they interacted with one another from each other's disciplines and made a better product than if they were to do it on their own. We uncovered 40 different opportunities that we can help to transform the health system for all of those outcomes that we want. So the collaboration is absolutely essential to co-create the solutions that have meaning for our patients and our communities. The other piece is that I went to school as a nurse, Frank went to school as a physician. We have different bodies of knowledge and we study different things. And he doesn't know what I know and I don't know what he knows, but when we're together and we're combining our efforts, either from an administrative perspective, from a clinical perspective, 1 + 1 = 3. Add other disciplines and it's exponential in terms of the impact that it has on patient care. And so I was privileged enough to work with leaders at TMU to look at IPE, interprofessional education at the new medical school. And they are doing it by design. Again, get right to the root of it, doing it by design and building core curriculum, building these concepts right into our new leaders, our new physicians for the future. So it is application of knowledge into practice so that we can enhance the system in this transformative way.
Thank you, Tiziana. Dr. Yafola, how do you see collaboration across these disciplines enhancing the overall transformation of the system?
Thank you. So certainly with oncology and cancer care, it's a multifaceted approach to a direct patient care and involves many other people than just the oncologists. To speak to our nursing colleagues first, they are absolutely essential. They are usually the first point of contact for any patient concern, intake assessments when coming into clinic, answering patient concerns on the phone, administrating and overseeing the infusion of various chemo and immunotherapeutics. Here at William Osler, each oncologist has a primary nurse to develop the rapport with these patients and help optimize the management of those afflicted with cancer. On the other side, we also have close collaboration with our palliative care team to help manage the symptoms caused by cancer, bringing more resources into the home and overseeing end-of-life care. This is an absolute essential service to ensure there are no gaps in the care of managing these cancer patients. Hence, we collaborate closely with our nursing and palliative care colleagues. When 3 domains come together with different perspectives, yet all unified with the common goal of improving patient outcomes, new problems and solutions then begin to surface. The need to do better for patients, to improve quality of care, drives the want for transformation that circles back on the current state of operations and demands change.
Thank you. And then Dr. Chasen, how do you see collaboration across these disciplines enhancing the overall transformation of the health system?
Well, not one professional can treat a patient on their own. I think that's the key message on all of this. There's expertise, as Tiziana mentioned, Frank, there's other expertise that Marco was mentioning, and I say it as well, that the more people that could be involved and the understanding that the clinicians communicate with one another, it's all for the benefit of the patient. So it's not just the palliative care physician or the oncologist, but it's the nurses, it's the OTs, the dietitians. It's true multifaceted care that when directed and putting the patient in the middle, as we've said with patient-centered care, that this all comes together to provide the most efficient care.
Thank you for that. Yes, certainly a strength of Osler as a large community hospital is as our team. Dr. Yafola, your work in immuno-oncology biomarkers is groundbreaking. Can you explain how your research helps to personalize cancer treatments and improve patient outcomes?
Thanks. So cancer is a disease with many different outcomes despite a similar diagnosis. The observation that only some cancer patients display robust response to treatment, or develop debilitating side effects while others don't, has certainly fueled the cancer research community to investigate the underlying molecular mechanisms that govern patient outcomes. As no two cancers and no two patients are truly alike, we now found ourselves in an era of precision medicine that aims to take individual variability into account when creating treatment regimens. Biomarkers really refers to a surrogate of disease or treatment, usually through minor invasive means such as sampling blood, urine, or even feces from patients. This is compared to more invasive methods such as doing a biopsy that can pose a larger risk to patients. Ultimately, biomarkers are really accessible ways to monitor the disease and/or the response to treatments. Here at William Osler, we have several different biomarker clinical trials that are to learn the features in the blood and urine of cancer patients to help understand and predict response to the treatment or developing side effects from the treatment themselves, including the immunotherapy drugs. Over time, we expect the cancer landscape to change into a personalized portfolio of the patient's disease that will allow us to pick or even design the correct treatment plan and be able to accurately predict the risk of side effects.
Thank you for that. Unfortunately, I think each of us is impacted by cancer in some way, and that will increase. So thank you for your research. Dr. Chasen, you walked us through some of the elements of POET and palliative care. Can you share how integrating palliative care with other medical specialties impacts patient outcomes and how your research has shaped this approach?
Sure. So if I may use the example of the oncology and palliative care interaction. Broadly speaking, oncologists do a great job of treating patients who have cancer or treating the cancer of their patients. And the palliative care physicians will look at those patients and maximize their capability to receive these treatments. So when we evaluate patients, we're evaluating the symptoms of patients that they experience. Pain, nausea, depression, weight loss, anxiety, and depression are just some of those. And if we can make that patient the best patient to receive the best treatment, then we will have advanced the capability of that patient to actually either be cured or to have that disease very well controlled. I think that's the basis. It's a sine qua non. You know, we don't treat patients with cancer without an oncologist, and very different for the oncologist to treat patients with cancer without a palliative care support staff.
Thank you. Tiziana, how can research initiatives be better aligned with clinical practice to ensure transformation efforts lead to measurable improvements in patient outcomes?
So I'm speaking with our researchers and clinicians, and we've got the administrator. And so my role really is to look at how do you create those collaborative structures. So really wanting to explore how is it that we as an organization who are embarking on this journey, what is it that we have to do to ensure that we better align our practices with the transformation efforts? And for us, an example of that is through our community-based research advisory council, as well as our research advisory council that has been in play for a number of months since in lead up to our launch. And there is such an excitement in the community related to that. They want to be part of this. I think we got over, 100 applicants that wanted to be part of CBRAC. And so building that infrastructure allows us with a pulse check, our ability to go to that group and better understand what's important. And then they have their own connections as well into the community. The other piece of that is around co-designing research with clinicians and patients. We hear from clinicians that what's important to patients because they see them every day. And we also hear from patients about what's important. So we want to link those up and have the mechanism for that voice to come forward. The other piece is embedding research into clinical workflows. So we've got to get the white ivory towers, apologies for anybody in academia who's here, but to get out of the ivory towers and into our system and work collaboratively. So really proud at Osler that we are the first in Canada to launch our academic practice partnerships. It is a partnership with select academic partners who are working with us to operationalize our model of practice research and education to bring the academia right into our units so that we can support our clinicians, nurses, physicians, to look at application of knowledge to practice. So that's one way we're doing it in a very structured way. We have 3 academic practice partnerships, and we together, what we're doing is we're saying to the nursing staff, what's important to you? Like, what are some of the problems that you're facing? What do you need to be a phenomenal mentor to our new, our learners? And we're researching that question. We have 3 research projects currently underway. So that's a real life situation of where we've invited our academic partners to sit with us and design research questions that will generate findings for us that then we can put back into the system. So that's part of the loop that I was referring to previously. And then the other piece is, I'll just mention, is around the training clinicians in research literacy. Whenever you say the word research, people kind of get nervous. It's like, I don't do that. And we want to demystify it. We want to take that fear away from it and understand research both from a development of questions to the implementation of the findings. And so when we do that, we're like, oh, well, I am engaged in research. I'm engaged in this part of that research process. And so as part of our academic practice partnership, we are developing a micro-credential for our clinicians to take to start to incrementally develop and build their capacity to better understand research and all its phases. As we're doing that, we want to ensure that we are building a culture of continuous learning and curiosity. And I say this often in our quality work, but I always, and embedded in this work here is, whenever you ask a question, you are making the environment safer. Ask a question and you make the environment safer. So if a nurse says, what's the rate that I need to put that drug in? She just made the environment safer. Asking a question from a spirit of curiosity, learning, and humility, that's what we're trying, that's what we are doing with our staff, and that's building, again, those connections. So we're making it happen in an ecosystem in our healthcare system, and we're engaging our families and communities in making that happen.
Thanks, Tiziana. I love hearing about the academic partnerships. We are following suit with the OHT and hope to have learners go through our community programs as well. So very excited about that. I think we have time for one more round of questions before we go to the audience. Or do you want to go to the audience questions? Okay, we're going to go to the audience questions then. Don't be shy.
Yeah, no, it's better if you do it through the mic, and then it'll get recorded.
Thank you. So thank you, panel. Very interesting discussion, and you're all very cool. So my question for you is, while we talk about transforming the healthcare system, what are some of the most significant barriers to systemic change that you've encountered, and how can we research and innovate to help overcome them? Anyone need a mic back?
Sure. I hesitate to say this because I'm feeling the glare from over here. And we've been coached and mentored never to say that finances are an issue, because we will find a way. So I'm hesitant, but I will say it with the caveat that resources, be it human resources, financial resources, space resources, are confounding variables to making this happen. Are they insurmountable? 100%. Understanding, though, that it's in the context of what we do for a living. So when you're talking about, and we're doing that now, we're relocating some of our administrators out so we can make space for oncology patients. Yeah, we're going to move our staff out so that we can get space for patients, right? So when you have a triage of, do you invest in this, or do you provide direct patient care? Do you invest in this area, or do we buy a pump for a patient? Those are some of those competing priorities that we deal with. We tackle them every day, and we have a phenomenal executive team and a board that supports the work that we're doing. That sort of comes up to the top. The other, maybe I'll pause and let my panelists chime in with other barriers.
I'd hate to agree, but resources are definitely going to be the biggest implication towards pushing our research forward. The reality is we need grants, and we write grants, and we lobby to governments or to pharma sponsors to help fund our ideas. And then we need the support of the institution to create that space, to help build the biobank, to develop freezer space, et cetera, to store these patient samples, and then subsequent funding later on to analyze those samples, working with some of the bigger institutions, such as the Mars building in Toronto. But I no doubt, like any other big issues in the world, that resources and funding is going to be the largest barrier. There's certainly not a lack of want. There's a strong appetite for research. Goodness knows we have a lot of summer research students showing interest, as Patty can attest to. So the want is there. It's just being able to utilize that want with the resources at hand.
So I'm going to ask you all to look at it differently. You know, none so blind as those that will not see. We've heard very much how much resource we don't have. And I'm going to ask you to look at it how much resource we do have, and saying how much we can still get in order to move the vehicle forward. So looking at what we have and how we can build on this in order to provide those necessary answers to the questions that we have. So we need to be innovative, we need to think out of the box, and we need to act on that.
Transforming health systems sounds like a very ambitious goal. What are some of the most challenging aspects of implementing research findings into day-to-day practice, and how can we make this process more efficient?
Can you repeat the question? Sorry.
Transforming health systems sounds like a very ambitious goal. What are some of the most challenging aspects of implementing research findings into day-to-day practice, and how can we make this process more efficient?
So I'll speak to it from like an organizational perspective. We have 4,000 nurses. I'll just give that one example. We have 4,000 nurses at Osler. Say, for example, we know that minimizing the development of a pressure ulcer, best practice means you need to ensure that all nurses are assessing for the risk of the development of a pressure ulcer. We need as an organization and as an entire system to ensure that we give all of the system structures and processes to those 4,000 nurses to be able to assess it and do it properly, document it in a system that's going to uptake that, and then enable them to understand the risk and then implement preventative strategies. Okay, that's just one best practice intervention. So now we have, for wound care, we maybe have 30, 50, 60 recommendations that we need to put that into practice. So multiply that over and over and over again, and understand that the margin of error is very narrow. It's healthcare, it's not putting caps on bottles. And so when we're talking about large scale implementation of interventions, it requires a very systematic, and it's called implementation science. And so there's a methodology to it. We do it. And the way that we enable that to happen is absolute alignment across the organization, that application of knowledge to practice will provide positive patient outcomes. And so you have to adopt that. And that's why we have quality in our strategic plan and application of evidence-based practices, because we know that that works. In the absence of that, it gets very, very challenging. But it's just the magnitude and the scale of our organization to not only implement it, but sustain it is what the challenge is.
Hi, everyone. I have a question for Tiziana, maybe for others as well, but I appreciated you bringing up the idea of decolonizing our systems. I was wondering if you could speak a little bit more about maybe how people in this room can begin their own journeys or what you've done in your own work to decolonize understandings of health or to respectfully and meaningfully include and center Indigenous perspectives, holistic perspectives of health in their work. Thank you.
You're speaking to a novice, because that's where I'm starting in my journey. I am a novice. I am Canadian born, first generation Canadian, but I'm today years old, not too long ago, where I realized what my history was here in Canada. And so we have taken a journey on personally with our executive team, as well as the organization and the board, to become more informed. We have placed it on our, these are action items. I just want to, you asked me for some things that we've done, meaningfully have done. And so we believe that it starts with the leaders in the organization. And so we have put it front and center on our QIP, on our quality improvement plan. That's a public facing document. It's approved by the board. It's brought forward by our executive team and our leaders that this was something around becoming more aware of EDI, Indigenous practices, how we can deconstruct our own ways of thinking and then implement a different way. We don't know what that is yet because we need to become informed. But our board has committed to learning. Our board is committed along with our executive team to come to this space in one of humility and being supported in that journey by elders and leaders in the community. We've also transitioned that to our staff. So, and our board challenged us because they said, we're going to be 100%. That was the goal that the board set for themselves. So that's how aligned they are. We also have our physicians aligned with our race-based, what's the term, race-based correction. So there are, again, I'm still learning, there are laboratory tests that have race-based indicators that are basically discriminatory and have put barriers up so that others who are not from a particular group don't necessarily get the treatment early enough. And so we have a group of physicians, Dr. Paula Chidwick is part of that, and leading the work to take that away and create a more equitable health system. You know, we're on our journey to accreditation next October. And really proud, because I'm a surveyor with Accreditation Canada, that we have Indigenous standards that have been embedded as part of that, that says, if you want to be accredited with exemplary status in your organization, you need to implement this that speaks to creating that safe environment for individuals who identify as Indigenous. So we're working really hard to better understand that and how does examples, but it is, for us, it's a journey of awareness. We've also had book clubs on the bird tail and having leaders read that and reflect on it and understand how that impacts on them. So we're really early in on our journey, and we're humbled by how much work we have to do and our national history around that. So thank you.
Thank you. And I agree with the first audience member. Our panel is definitely very cool. So my question is, and so building on the previous question, actually, so in your respective areas, what is the role of equity, diversity, inclusion in health systems transformation and research beyond focusing on the diverse communities as research participants?
Can I get that question one more time? If that's okay. Thank you.
Certainly. So in your respective areas, Where do you see EDI's role in health systems transformation and research beyond focusing on the diverse communities as research participants? So typically we over-survey or we involve participants in research. We don't disseminate the data, but there is opportunities with the New Research Institute in reimagining what that might look like and being more collaborative and inclusive.
So there are a few concepts that I would like to speak about. And the first concept is that of unconscious bias, which is one of those day-to-day appreciations that we all should be aware of and respect and know that we probably are all, liable for this unconscious bias of prejudging people, thinking that we know what they would like, thinking what we think they won't like. And I think that's the first step to solving the issue, is to be aware of it and to make people aware of it, that don't actually feel embarrassed that they've been part of that unconscious bias. And if you could get past that step, then you're already starting to heal. So I think discussing it, reading about it, and have lectures over it and how it affects each and every person is the first step to moving forward.
Go ahead. Oh, okay. So thank you so much for your informative insights. One thing I would like to mention is that you all really mentioned patient-centered care. And with a diverse and rapidly growing society in Brampton and a low health literacy rate, how do you plan to build the trust in those patients when using their medical records for research or when using their samples for research?
I personally believe that trust and rapport with the patient develops from the moment of first contact, to have them instilled with the confidence that we're listening to their concerns, that they're properly heard out, and that we're ultimately designing a plan which they will hopefully believe that is going to optimize their best possible care. And the diversity can range from a wide range of possibilities from these multicultural community that we live within, to ensuring that we have translators present if we don't speak their native language, to ensuring if there's concerns for financials or food scarcity, which does come through our clinic, is properly attended to by our social work colleagues. These are some of the bigger issues that we certainly can foresee and try to help out with our patients to help ensure that they do have the confidence to know that we're going to provide them with the best possible care.
I'll just add last comment and then we'll have to wrap up. We know that there are members of our community that have been harmed by research and have been harmed in a number of domains. And so we go in understanding that and knowing that, and that they are, because of that experience, they are self-selecting not to participate. And that's a detriment to themselves, that they are not have the opportunity to participate in a clinical trial that could potentially save their lives. I'm just thinking about oncology research. And so they're self-selecting not to participate. We're at a disadvantage because we're not learning from that patient population about what's unique to them, that we then need to integrate into our care practices. And so it's a double-edged sword. Patty and I have talked about this in terms of saying we need to get away from, and this is a known entity in research, that subjects have typically been male and white. And we need to be inclusive in our recruitment to better understand the diversity of what exists from a healthcare perspective when someone from a diverse culture has hypertension versus ovarian cancer versus whatever diagnosis, what's unique to that patient population. And so the trust that you spoke about is absolutely essential. And so if you're taking care of someone and they trust you, and That's an avenue for recruitment of those patients to that study. So we can go on around that, but it's just, it's something that we are conscious of and aware of. And we need to understand what the patients want in that interaction as opposed to self-selecting and saying, I'm not doing that anymore.
I would just like to say there is a dictum on that. There is a dictum on that, is listen to the patient. He's telling you the diagnosis.
Okay. Thank you very much to each of our panelists for sharing your valuable insights and expertise. The insights such as needing everyone to translate our research into practice, that we need customized approaches for the unique realities and the diverse communities that we serve, and that health equity needs to be a central part of that, and that we are on a journey to that place. We're particularly impactful examples of pivotal research, of research collaboration, the pivotal role of research collaboration and continuous innovation in building a more patient-centered healthcare system. So to our audience, I encourage you to stay engaged with the ongoing research initiatives at Osler's Research Institute. And I invite you to join us at 2 p.m. Where we'll continue exploring these transformative topics, and I'll be in the hot seat. So thank you for being part of today's conversation. Thank you.